My name is Scott Kohlert, and I'm an otolaryngologist, head and neck surgeon with a special interest in head and neck surgical oncology at the CHRISTUS Trinity Clinic. I grew up on a farm in Canada. We had an elk farm with some crops as well. It's a lot warmer down here in Texas, which is nice. I do really cherish, though, the time that I had growing up on the farm in Canada. It really taught me a strong work ethic, working with a team to really come together for a common goal. And so I think that really played a huge part in bringing me to where I am today. My parents, my family had a huge influence on me growing up. They really instilled a lot of my core values, my work ethic, like we talked about, my sense of integrity and loyalty. I think I really owe a lot of that to my family. Initially, I wanted to be a dentist, and then I got really sick when I was in high school and ended up in the hospital for a while. And I think that kind of changed my career trajectory a little bit. But I'm kind of very happy with where I ended up. I find it very fulfilling to know that I can go to work every day and potentially play a major role in somebody's life. I was initially drawn to ENT because of the intricate nature of the surgical procedures that we do, as well as the wide array of different conditions that we treat. But then I really then pivoted a little bit and went and did extra training in head and neck cancer. And there I find that it's where I feel like I can really make the biggest kind of impact on somebody's life on a day-to-day basis, and it's been extremely rewarding. I think that the overarching theme in my patient care philosophy is really making sure that my patients receive the same level of care and compassion that I would expect for a family member or one of my friends. And I think a major part of that is making sure that you spend the right amount of time with each and every one of those patients, to give them all of the information about their diagnosis and to really equip them with the tools and the information that they need in order to help make the best decisions for themselves moving forward, and B, to allow them to have a little bit of time to process that information, especially when it's a cancer diagnosis. That can take a while for that to really set in for patients, and they're going to have more questions, and so to then bring them back and spend more time answering those questions and really coming up with a plan that best suits them moving forward.